Good afternoon, everyone. Welcome to this webinar. We are at 4:01 and we've got a lot of colleagues still joining. So we'll just give a few minutes before we get started. Good afternoon, everyone. Thank you for joining us for this webinar. We are just giving it a few more minutes. As we speak, there are a lot of folks joining in. So we'll just give it a few minutes and we'll get started. Just to let you know some housekeeping rules. We have the Q&A option. So during the discussion, if you have any questions, please feel free to put it on the Q&A option. Don't use the chat option, please. Please use the Q&A option. We'll be tracking that mode for responding, once the presentations are over. Okay. Again, very good afternoon to all of you, ladies and gentlemen, for joining us on this webinar this Friday afternoon. My name is Manish Lalwani. I lead the branches and the corporate segment for Marsh India. And we have a esteemed panel of our fellow colleagues who will be joining me in this webinar today. We have Rawal Kalita, who leads our EB practice for Marsh India. Tanushree Sinha, who's our SVP and EH&B consulting colleague. Gopinath is EVP, EH&B consulting. We've got Dr. Rajiv Agarwal, who leads our consumer business, from the TPA Command Center perspective and the digital health engagement on the consumer business side. Arhan Gotadke, Balaji, and Rajan lead our EB business in Bangalore, Hyderabad, and Chennai respectively, and Gaurav is our colleague from EH&B Consulting in Hyderabad. What I'd like to do is, first of all, thank you for taking your time out and being a part of this webinar. This is more a survey results sharing today, tomorrow, and beyond. And what is really will be discussed today is about the latest trends and developments that we've seen in the wake of COVID-19, as we all know. Now, never before has benefits and benefit strategy been so much into spotlight as it is today. As we speak, HR colleagues, C&B colleagues, finance professionals across organizations are really taking a deep dive and trying to understand the value equation, trying to understand benefits, trying to understand how do we really shape the benefits to make it more colleague-centric and employee-centric. As we've seen, not just the need to have insurance and health insurance has gone up, but COVID-19 has also accentuated and accelerated some of the very innate and dormant trends that we were seeing from the last few years. Whether it is digital health, preventive care, mental well-being, it is about domiciliary healthcare and outpatient care. These were some of the trends that we were seeing from before. But COVID-19 pandemic has really accelerated the importance of these trends. And we will see today later in the presentation how they have really come into big spotlight. What we've also seen in the last 4 to 5 months is all stakeholders in the ecosystem have, stepped forward, have gone up to respond to what our clients and our customers, that is our employees and HR colleagues need. Be it insurers, be it TPAs, be it the hospitals, and of course, be it the regulator. The regulator has been very, very proactive in coming up with new guidelines to really facilitate claims and to enhance and broaden the coverage of health insurance. On the benefit side, because of work from home, we've seen new trends emerge and organizations really going back to the drawing board and recasting some components by introducing more helpful support for employees working from home, and we'll see those as well. As Mercer Marsh Benefits, we've always believed in bringing in thought leadership to our clients. And thought leadership today comes not by just rhetoric, but it comes through data-based insights. And what we like to do in times like this is really run data-based surveys. These are primary research that we do with our clients and then share the trends with you back. So what we are going to present today is not just what we think, it is what our clients believe and what's going in the minds of our clients. And that is what we will be reflecting back today to you. So I believe it'll be quite an insightful and engaging discussion that we will have. We will have a bit of a panel discussion later. And I would request all of you to kindly please put up your questions, because the webinar will be most impactful and productive if we can hear from you and kind of respond to some of the queries that you may have in mind. So without much ado, we will dive straight into the agenda, and I'll pass the mic back to my colleague Tanushree to take the next few slides. Tanushree, over to you.
Thank you, Manish. Thank you for setting the context. Good evening, everybody, and I welcome you all to today's webinar. So before we start, I would like to start and share the survey findings with you, and most of you would have participated in this survey as well. We would like to start with a poll question. So request you to kindly use your screen and vote accordingly. So we're asking that during the pandemic, which has been your highest priority area in employee health and well-being policies and practices? Just a quick feeler to understand that what is the current market sense? So there aren't any much surprises, because as we see 96% calling out and saying that employee well-being is what has been their utmost important thing. And with that is what we have designed all our strategies around. Thank you so much for voting. Moving on to the survey findings. So as I mentioned that, what you voted currently as well. So employee well-being has been the core of every organization. And, so 2020 will always be remembered for the kind of pandemic that we have witnessed in our lifetime. But in my sense, it will also be remembered for the fact that, the kind of resilience, adaptability, innovation, each and every organization actually demonstrated during this time. So in their own little ways, they have gone ahead and done things which is remarkable. And some of them I actually have captured in my survey findings, which I'm going to walk you through. There are no surprises because in terms of employee well-being is something that has been the core, and the scope of the survey also extended to employee well-being, benefit strategy, and benefits budgeting. We had about more than 152 participants who participated in this survey, spread across 15 plus industries. Unequal participation, you can say, from both core and the services sector. So the endeavor was to understand that, during this pandemic, how are employees dealing with things like, employee well-being? What is that differently, what they were doing? What is the benefit strategy? What is the re-engineering that we need to do with the current strategy? So everything that we had put together in 2019 for 2020 had to be revisited and changed overnight. And similarly, the benefits budgeting accordingly. So of course, employee well-being, which is at the core of every organization, and even that's what we saw from the current participants, it had to be transformed. So 87% of our employers said that, they definitely identified health and well-being as their topmost priority when we spoke about strategy. So we had also done a survey pre-COVID to understand that, that was a normal health and benefits survey that we had done. And, I'm glad to present some findings, which is pre and post pandemic numbers. So if you see that digital solutions, what we are talking about, so digital solution pre-pandemic was 17%, which went up to 81% post-pandemic. So of course, when we say digital solutions, it includes digital well-being, digital communication. So all modes of everything became digital. Mental well-being, EAP, we all are aware that, during this pandemic, while the primary and the preventive care is equally important, what also surfaced was that mental well-being is equally important, and we see the shift there as well. A lot of companies are also, we are aware that, there are a lot of companies who are also doing a lot of financial well-being programs, consulting services being offered to employees. This definitely helps employees organize their finances much better during these times. Benefits budgeting was the next thing that was highlighted. So of course, we had budgets that were decided in 2019, and there was no additional benefit budget that was coming along. However, with the budget in hand, it had to be optimized and channelized in a way that, that makes most to the employees. So 76% employers again here say that, they could foresee a change in the benefits budgeting that they had done at the beginning of the year, given the pandemic. So 89% actually said that they were contemplating new arrangements in response to this outbreak and to deal with it. So clearly two pillars that stood out. One was looking at the entire insured benefits portfolio as a whole. Second is the flexible benefits piece. So when we spoke about when we speak about the insured benefits portfolio, so it is, the core was like looking at a co-funding and a co-sharing model. So looking at revisiting all that was being offered, going back to the storyboard and seeing that, if the core benefits that are offered, are they adequate? Do they need to be revised? How can we bring in more plans which are beneficial to employees and at the same time cost effective as well? Flexible benefits were the other pillar that emerged. So, as I had mentioned some time back, that we had done a pre-COVID survey as well. At that time, about 54% of employers at that time said that they would like to consider flexible benefits. However, post-pandemic, this number goes up to 84%. Now, while, as HR professionals, we know that, there are pay cuts in the market, there are job losses which are happening. There is no additional budget that is coming to us to go ahead and hire that niche talent that we need from the market. So how do we still go ahead and attract and retain that talent? So benefits today is the hero that stands out. So it is about offering that diverse choice to employees, bringing a plethora of benefits on the table, moving into a cost sharing model where we are saying that I'm going to bring you the best in class benefits. Let's you pick and choose what meets your requirement the best. So flexible benefits, moving from a very defined benefits to a defined contribution model. And there were other things that were done by organizations in terms of the remote working arrangements, some of which Manish also touched upon while he was talking about the larger landscape. So, infrastructure support, allowances on internet, mobile bills, digital solution, of course, we will constantly touch upon that because digital solutions from every aspect has seen a new light and a new way of communication and keeping employees engaged. Last but not the least was looking at the overall benefit strategy as a whole. So while we looked at the benefits budget, we looked at employee well-being, how we can differentiate and bring in things. But it was also important to look at that, how do you re-engineer the overall benefit strategy? So there were a lot of things that organizations were doing. So whether a regular connect with the leadership or the CEO, just to ensure and tell employees that, we're there for you. It's happening. We are there. We are connected. We're one family. Organizations bringing in innovative offerings like, in lack of the crash services, bringing in stuff like nanny service or a babysitter support, home care services, bringing in laundry or delivery support to employees, just to make that overall work from home scenario much easier. While there was strategy that was being done by each and every organization, the market also came up with the solutions which were required and addressed the need of each and every organization. So whether it was a pandemic cover or a voluntary top-up cover or OPD covers. And similarly, we at MMB came up with extensive solutions around each of the requirements of our clients by offering support on digital communication, flexible benefit solutions, support on digital healthcare solutions. So it was a combination, the need, so both the products and the solutions are something that we brought it together for all our clients. A quick look at in terms of, when we did a deep dive to understand that, where in terms of industry. So I would like you to take a moment to see that, how do we position ourselves here? So if we look at a pandemic cover, so if you see BFSI clearly stands out way above the all industry mark when we spoke about a pandemic cover. If we look at remote well-being programs, so if you see again, high tech and BFSI standing out and doing much more than what our all industry marks shows. So, so this is just a quick mapping to see, and you can take a moment to see that, where you plot in. Now, I would like to invite Gopi to walk us through the impact of COVID on employee health and benefits. So Gopi, over to you.
Yeah. Thank you, Tanushree. Let's move on to the next slide. Yeah, so before we move into what could be the possible future tactics in terms of how do we handle the COVID situation, we'll just touch upon a few figures at a macro level. So starting with the All India figures, so these are information that is published by the COVID India organization. And these are figures as at 14th of September, which was at the beginning of this week. So we have about 4.8 million cases that were totally infected, out of which 78% recovered, which is a good number, and that's actually creeping up, which is good news. However, the deceased was close to 80,000, which had a mortality rate therefore of 1.6%. If we were to compare these figures with the numbers that we have seen at MMB India, which is Marsh India, we have about 11,041 cases with a recovery rate of 87% and a mortality rate which is slightly lower than the All India figures at 1.3%. All of you here could also be curious to know what it was just for the employee. So if we were to see that out of the 11,200 odd cases that we are reporting, There are about 4,000 odd which pertain to just the employees, and their own recovery rate is much higher than 87%, and also the mortality rate being at only 0.4%. Just to add quickly, there are about 78% of all of the COVID claims that are categorized as mild to moderate. However, there are 4% of claims that are largely due to the comorbid conditions that are categorized as severe cases. The bottom table shows again for MMB India data how does the claim size spread across the hospital day stay. So if you look at, we have used color shades between red and green. Reds or the darkest shade of red indicate that particular band has the highest concentration of claims, whereas the green indicates the lowest. So as can be seen, close to 50%, in fact 48% of the claims are below the 1 lakh rupee size. If we were to further look at it across the hospital day stay, under 10 days is where the bulk of the cases are. So even 1 to 2 lakhs, you have about 2,000 cases, and that's that particular band to the overall total accounts for 30% of the cases. Towards the right hand side, we are showing the average bill, or rather the average claimed cost that an employee or the claimant makes across various regions for which Marsh is the partner. So they're more or less similar, except that West is clearly at a lower number at close to 1.3 lakhs. If you look at South, North and East, they are more or less around the same number for an overall average of 1.55 lakhs. Moving forward, so these are some of the challenges that we are encountering, especially when it comes to the COVID claims, because there is a lot of noise around why the COVID claims are not paid as much as what a non-COVID claim would. So we sort of tried to throw some light on it as to what is the reasoning behind that. And when we split the claim into these 4 headers, which is room charges, consumables, medicines, and others. Now others will have in it lab charges, investigation charges, diagnostics, surgeons charges, consultation charges, and all of that. So if we were to just look at what is the composition of the claim between a non-COVID case and a COVID case, this is how it pans out. You see clearly 25% for a non-COVID claim is how the room rent contributes. Whereas when it comes to the COVID claims, it is significantly high, 37%. Same as the case with consumables. It's only a 10% for the non-COVID claim, which employees are okay to shell out from their pockets, as against close to 30% with the COVID claim, which is where a lot of hue and cry happens. Now, if we were to further look at the payout ratios for this composition of claims, it is very clear to understand why there is a lot of noise around the COVID-related claims. The non-COVID related claims has a payout ratio of about 80%. Tanushree, if you can just. Yeah, so the payout ratio for a non-COVID claim is at 80%, whereas for a COVID claim, it is only around 55%. Now, there are clients who have it close to around the 60-65% mark, despite having rich benefits. But the ones that have a room rent limit in place definitely see that the payout ratio is pretty low. Just a matter of fact, payout ratio is for every 100 rupees that is being claimed by a claimant, what is it that he or she gets in return? Yeah, so as I was talking, so these were the key challenges that we encountered. So increase in out-of-pocket expenses towards the non-medical expenses, which is NME, and also the consumables, which is significant when it comes to a COVID claim. Room availability is one criteria, along with once it's available, the room rent itself is a bit of a challenge when it comes to a COVID claim. Other key cost drivers are the PPE kits, the sanitization, fumigations, and etc. So now all of these put together are the ones that are sort of putting employees in a bit of a quandary. We have a few insurers who have taken note of this and have extended a few of the waivers when it comes to policy benefits, like say they're saying for COVID-related claims, the room rents can be waived off, and the consumables or a part of consumables can now be considered as payable items. Now, these are some of the things that a few insurers are doing as part of a goodwill gesture. However, such circulars were issued around July, and all of them are set to end, rather the complementary period is supposed to end by this September. So therefore, moving forward, if clients want to enjoy all of these benefits and waivers, they will need to be paying additional premium, which Marsh, of course, will help facilitate and get you the best deal. We'll move forward. Yeah, the impact that COVID has had on our healthcare in India is broadly classified into these four headers. So delay in surgeries is one thing, definitely, because you see that a lot of critical surgeries, or rather non-critical surgeries, which can be postponed, have actually been postponed and are getting postponed. There is a drop in ICR, so about 10 to 15% is on an average. Now, this differs between geographies in India. For example, the North and West are seeing that the claims are coming back into the system already. However, the South and East, you're seeing that with the lockdown or the restrictions still in place, people are still not going to the hospital as much as they used to before. Rise in medical inflation is another concern. Delay in care is going to deteriorate a person's condition. So therefore, when they eventually go back to making the claim, it could come at a lot higher cost. Plus, the hospitals, having not been seeing a lot of footfall, will be looking to increase the rates as well. So therefore, what was initially predicted as a 9.6% medical inflation is now being looked at 10 plus percentage scenario. Mental health has, Tanushri also pointed out in the survey findings, has taken top spot when it comes to attention. And as can be clearly seen, about 70% of upsurge in mental health counseling sessions that have taken place. And we have also, through our clients, come to know of all of these. We'll move forward to the next slide. So this is how the strategy would be looking at. There are three major headers again, like claims ratio, claims projections, and the benefits optimization. While we call out these as the challenges, and the ones that are shown below are the possible solutions or strategy around how we should be countering these. For example, claims ratio, today we are seeing lower claims ratio. That necessarily does not indicate that that the portfolio is actually healthy. That's because claims are not happening for the reasons that I've just been highlighting on the previous slides. Claims projections, there may be varying views from both the insurers as well as the clients. So we have tried to highlight those. Some of you might have already seen it during our discussions when we do the renewal strategy discussions or quarterly review discussions, where we have highlighted two different projections, one with a normal scenario, how the claims would have panned out versus how it is currently. And it is important for the clients to know that what it would have been in a normal case. So therefore, if you were to then strategize in terms of wanting to keep your budgetary constraints or budgetary targets in mind, then we will recommend that you look at the normal scenario projection so that the next year you don't see a significant increase in the premiums. The benefits optimization is another thing that we're looking at. There are clients who have seen claims ratios pretty low at around 70-75%. For such clients and within those clients, ones that have been pondering over the years as to how they would want to increase their core benefits, such as sum insured, room rent, and those that they have not been able to do because of cost constraints can now actually be able to do that. So our suggestion is to right now is the time to look at such optimization and benefits and move forward so that we have sort of come up to the benchmark when it comes to benefits. I hand it back to Rahul, who will be taking this forward. Thank you so much.
Thank you so much, Gopi. A warm welcome to everyone. Thanks for joining us today afternoon. It's a privilege to host you out here for this webinar today. I think Gopi, Tanushree, and before that Manish has covered a significant part of how we are all responding to COVID today. I'd like to take this opportunity to present some thoughts and point of views around how do you think tomorrow may be, and of course beyond tomorrow also, how do you think the cost and benefits would be balanced by enterprises, and how do we as a partner support you in that journey. So I think with this, we'll quickly move to some of the thoughts that's setting up across our clients. And when we interact with clients, we do see some of this, being articulated to us by all segments of clients. So for example, one of the key thought is around how do I manage the cost part of it, as well as invest more in my health and benefit, because this may not be the right time to actually cut down on my benefits, to actually compromise on my benefits. But this is the time probably to have a revisit of my benefits and see what I've not been able to do so far. Can I do it more? Just one example, a lot of corporates are talking about reconsidering enrollment of parents in co-funded plans. So there are clients who don't have a parents policy today. They are actually thinking louder and thinking whether they should have a co-funding approach to cover their parents. That is only one part of it. At the same time, there is a lot of it that's unknown to us. So clients are also asking us questions around how do I manage what is not known to me? How do I manage increased exposure of risk? So what we see as COVID today, till maybe in the month of May, our challenge was largely to manage IPD hospitalization of COVID-19. But when it came to July or August now, most of us are worried about how do I manage the home care treatment? How will my policy respond to home care? And again, of late, we might be all hearing about the fact that yes, the payout ratio of COVID-19 claims are lower. How do I manage that? So these are still problems of today. At the same time, clients are also saying that, okay, this was a year when we saw COVID happening. What if tomorrow there is another pandemic? What if tomorrow there is anything that's unknown to us still happens? How do I respond to it? Thirdly, we are hearing clients talking about how do I automate my benefit administration. With most of the employees, in every organization now having to work remotely, clients are talking about benefit administration in a more automated manner, because I think the current way of managing databases, managing our accounting may not be sustainable in the long run. Lastly, I think, clients are talking about well-being strategy to be more relevant for tomorrow and beyond, because, what is to be prioritized? Right now, we are seeing that, yes, we are more keen to invest in digital healthcare, but then, should digital healthcare be also integrated with my overall well-being, strategy? So I think those all things are there playing in our clients' mind. And more importantly, I think while on one side, we have to balance cost with empathy, on the other side, we are talking about building a culture with flexi working being the reality tomorrow. Most organizations are talking about anything between 40 to 50% of their workforce actually not being in office, even post COVID-19. So in that case, how do we, ensure that our employees are well engaged? How do we ensure that the culture of health and overall well-being is still communicated to our employees in as many ways, and how do they stay engaged with us on a holistic basis? So these are questions which clients are seeking answers for, and we at MMB are partnering clients globally as well as in India to have answers for this. What we have seen so far and what we continue to see, what we'll continue to see even next year would be the increased need of protection. So yes, the need for protection is, if at all, going to be more accentuated. So even tomorrow, we are likely to see more need of protection. The protection level today, we are mostly considering around health insurance, and suddenly COVID-19, the possibility of multiple members in the family being impacted being higher. Therefore, the current sum insured sometimes may not look adequate. But at the same time, clients are also now talking about looking at life insurance. I think one of the survey that we did globally indicated that there is a 300% increase in terms of people being keen to draft their wills. I think when people are talking about drafting their wills, it does help us understand that yes, they are worried about their own life and how do they stay covered. And also with that, we must all realize that yes, in life insurance, a lot of times, medical underwriting is not possible today in the current situation. Therefore, employees are also not sometimes being able to, take a retail life insurance policy to cover the gap that they see today. So how do we have solutions for that? We at MMB are keen to partner with you in some of this journey, and we do have very interesting voluntary term life solutions also. Aside of whatever we did with all of you in the health insurance side, there are also many interesting solutions around that. We also see more reliance on outpatient care and home care solutions. I think we all understand that large part of a healthcare spend of a family is on out of pocket. Still health insurance is something which will typically cover you only for the hospitalization. But beyond hospitalization, the spend that we have on out of pocket is something that's still not covered by most of the health insurance policies. So OPD will gain more prominence. And OPD, do I add it in my core benefit, or do I look at putting that as a voluntary model, is something that clients are seeking answers for. We'll encourage clients to look at both possibility. Wherever they think that their benefit budgets will allow, wherever the strategy will allow to look at OPD as part of the core benefit, yes, why not? But at the same time, if a 5 to 10,000 rupee OPD level within the core benefit may not be in any case sufficient, so we may want to look at launching voluntary models around OPD care. And there in those programs itself, we can look at structuring home care as one more solution. A lot of emphasis would be on care and community. So clients are also talking about engaging the employee as a unit, because with COVID-19 we all realized that just to ensure that the employee is safe is not enough, because ultimately the employee is now part of the family, and your workplace and your family space is overlapping with each other. And there is a possibility with remote working, with all the digital platforms to engage employees. It is also very much possible to engage the family members, and therefore why not focus on the well-being strategy to encompass also family members and not just focus on the employee group. These are things which all of us are embracing with utmost good faith about how do we manage the culture of our employees and the family as an extension. So I think with that we are also seeing a lot of demand for virtual healthcare. We are, like Tanushri also spoke about the fact that yes, digital healthcare is something that's emerging to be a very strong area of demand. In our own clientele, we are finding that the usage of digital healthcare, telemedicine, is almost at 713% increase. With this, I'd also like to make a note of the fact that regulator has been very supportive of including well-being as well as digital healthcare to be a part of health insurance. It doesn't mean that well-being or digital healthcare will be by default covered in our health insurance program. But what it means is that yes, we can together talk to our insurance partners and recommend them to look at a lot of well-being, and preventive measures also to be incorporated into our policy. It may cost us a little more than today, but it's probably worth looking at those options. Even when you talk about virtual healthcare, telemedicine, bill till yesterday was not payable in the health insurance policy, but today if an employee does a teleconsultation and submit the bill, it will be payable. So those are things which are shaping up, and the regulator is also very proactive in making these changes. Let's go over to the next slide. I think this is something we already spoke of, the fact that the workplace and our own family space is overlapping with each other with remote working, and all of us have today seen almost 90% of us today are working from home, with India remaining in, unlocking still, the reality is that we are all in a lockdown phase still in that sense. I think work and life, if we have to look at achieving the right kind of balance and develop more resilience, we have to look at the employee life cycle in holistically and look at, how do we support the employee when he is onboarded today. So for example, till yesterday, maybe we'd have done pre-employment health checkup, but today maybe those pre-employment health checkup may not be possible the way we were. So do we really look at replacing a pre-employment health checkup with a, any other medical questionnaire or a health risk assessment online? So what kind of solution do we see out there? How do we engage my employee when they are being onboarded? How do we do the induction for them in terms of, appraising them about what kind of health and benefit are offered by the employer? And all that has to be done digitally, and we are as your partner available out there to support you in those journeys. When it comes to well-being, a larger focus would be on digital intervention, but at the same time, the fact that yes, primary care would be needed, preventive care would be needed, and even mental health care support would be needed, financial well-being would be needed, cannot be ignored. So how do we build a good resilient model of online as well as offline engagement with employees? Because part of our population would be online and part of our population would be offline. So with 60% of our employees still being in office, we have to have a strategy to do both in-person engagement as well as online engagement. So how do we evolve that together? In terms of protection, I think disability or life insurance or critical illness are the other areas of need. We are seeing a lot of demand for critical illness in itself. So while life insurance does have a rider of critical illness, but also a lot of clients are talking about launching voluntary critical illness policy, and flex benefit in itself can help you cover many of these demands. I think with flex, like Tanushri spoke of, it has the beauty of evolving itself into the evolving landscape of health and benefit, and we all can together build more benefits in the flex space to ensure that your employees are well engaged there. So overall, I think the leadership need to be engaged more than before. to build more resilience. A lot of work need to be done probably around leadership connect, digital employee communication, and how do I support my workforce in terms of different strategies around telemedicine, promotion of health, and promotion of digital healthcare workshops out there. So that's about in terms of how do I take care of the resilience and health of my employees there, because they are all contributing to my bottom line. So how to take care of my employees during such time would be very important. Yeah. I think if I have to sum up this, while of course we have talked a lot about the renewal strategy and we have spoken about how tomorrow the future may be out there, but I think overall we see this 5 things to be emerging very clearly for tomorrow and beyond. One of them would be flex benefit. I think increasingly most companies are likely to consider flex benefits more proactively, because with flex we are able to move away from a defined benefit to a defined contribution. With more and more need in health and benefit being out there for our employees, there will be only that much we can do to support their need. So a large part of it has to be through co-funded models, and flex benefit is globally championed as one of the best co-funding model where employees can participate very proactively in managing their own benefits. A lot of design thinking can be done with remote working. Diversity and inclusiveness can be looked at very differently. So I think when we talk about tomorrow making our workforce more inclusive, it is very much possible in the digital space today. And I think already I can hear clients talking louder in terms of the D&I being reoriented with remote working being possible today. We already spoke about family and community care, and when we do all this, it is to be more about the it is to be also looked at through the lens of having the right balance of cost and empathy out there. I think lastly, yes, investing in health and benefit technology is going to be important. We spoke about digital automation. We spoke about digital healthcare. I think with all that, the advent of technology in the benefit space and health space is more or less clear. Probably we have accentuated the entire digital journey by few years with COVID-19. So yes, to invest in health and benefit technology would be very important. We at MMB have the right kind of solutions. You can engage us and we'll certainly be able to advocate those to you. We are talking about deeper leadership engagement and other things, and we are able to support clients in building those leadership forum, in building those leadership discussions to ensure that the health and benefit as a focus is at the leadership level also. Globally, MMB is a team of 9,000 colleagues. So yes, while Marsh and McLennan companies has almost 76,000 colleagues globally, out of that, a large part of our colleagues in employment benefit. So more than 9,000 employee benefit specialists are there globally. In India, we are a team of more than 300 colleagues in employee benefit who are specializing in this area, supporting more than 1,500 clients. We place more than $320 million dollars of premium. More than 5 million lives are covered. I think all this would give you the assurance that yes, we have the right kind of depth and breadth to help you partner in such turbulent time. I think stability of an organization, the financial stability as well as overall stability of the organizations are important to look at when you look at partnership. We have Darwin as one of the very engaging global health and benefit platform. Some of you are already part of Darwin. A lot of others who are not can engage us, and we will be happy to share more with you on that. Therefore, with that, maybe I'd like to quickly draw your attention to some of the workshops that we are doing. And many of you have been already invited, and some of you have registered for this workshop. Just to quickly highlight, yesterday we did a workshop around how do you look at spending on benefits around the world. So the global view of it, we had Shane Gobin, a leadership of Shane Gobin participating in that workshop yesterday. Next upcoming would be on 22nd September. That is around again the global outlook, and Schneider Electric is there. They are they are part of the panel, and senior leadership of Schneider Electric would help us understand more about it. Post this workshop, again we'll send you this invite so that some of you have not been able to join these events can join out there. Likewise, on 29th September, on 6th October, we have some more workshop with Lufthansa, FIS, some of these organizations partnering us in running this workshop. So with that, I'd like to end the interactive session from our side with a note that yes, nothing is more critical to the health of a business than the health of its people. Health is the bottom line, and we are there to support you in the journey of health and benefit. I'd like to open up the session for Q&A, and we do have some Q&A already in the tab. So I'll quickly, start taking some of that. And I think post that, we would also like to invite few of you to speak and, ask us questions. We have a lot of esteemed clients of ours today in this afternoon, we'll probably go out and speak to some of you out there. So I'll open the Q&A session here. So there are some of these questions, very interesting one. One of the question is about, are insurers or medical providers considering, to cover injury, while working from home? So for example, back injuries from continuous desk work. Quickly to tell you about this, yes, if the policy covers, domiciliary hospitalization, or if the policy is covering, any kind of musculoskeletal disease, which will, need a hospitalization, definitely it would cover, it would respond. But in the absence of any physiotherapy on OPD, it may not really cover. So if you're talking about any musculoskeletal issue, largely physiotherapy is one of the need out there. So it may not be covered in that case unless and until the policy calls out that yes, it can cover physiotherapy in OPD or consulting. Hospitalization would definitely be covered. We have one question about, from Bina Dixit out there. Bina is asking, how many COVID cases don't need any kind of hospitalization? Do we know, therefore, in cases where there is no need of hospitalization, how much the expenses out there are? So Arhan, you'd like to take up this question quickly?
Hey, thank you, Pavel. Thanks, Bina, for asking this question. Most people, about 80%, recover the disease without needing any special treatment or getting hospitalized. However, people who are aged above 60 years and people who have underlying medical condition like heart disease or respiratory problem or breathing issues or diabetic or hypertension, those are the people who might require hospitalization. Coming to your second question on the expenses, the expenses may range from like 80,000 rupees to almost more than 10 lakhs, what Gopi was also showing in his slide, depending upon the criticality of the patient. I hope I could answer your question. Thank you.
Thank you, Arhan. Thank you. We have one question from Vaibhav. He is the benefit leader for SAP. Hi, Vaibhav. We have been interacting in multiple forums, and I understand that one of the concern that you have raised is very true for across India, most of us right now as we speak, because what has happened is that GI Council is all the general insurance companies, they have a council, and collectively they have come out with a rate chart for COVID-19. So this rate chart sometimes is difficult from an adherence perspective in hospitals. So the question is, what is the role that Marsh is playing to influence insurance companies to take a more balanced view when it comes to claim settlement, given the recent GI Council guidelines? So I'll invite Dr. Rajiv to quickly answer this. And Dr. Rajiv, you're there.
Thank you, Praval. I think as Marsh, we have been proactively engaged with all the stakeholders, including the insurance company, as well as the TPAs, to ensure that this problem of higher deductibles, what we are facing, is being resolved, specifically around GIC Council guidelines. The problem here is that today there are multiple guidelines which are prevailing, within various states. So there are state guidelines, then there are GIC guidelines, which are prevailing, and somewhere there is a confusion with everybody that which guidelines to be followed. So we are engaging with the insurance companies to ratify this, and probably you will hear something positive news in coming week on this context.
Maybe I can add to that, Praval.
Sure.
So apart from just the hospital and billing, I think as Marsh, we've been able to work with the insurers and introduce a few other initiatives which possibly clients wouldn't find it easy to get included. To name a few, have the corporate buffer amount increased midterm. A lot of clients came to us and said, hey, we want to enhance the corporate buffer. So midterm, no insurer normally typically allows it, but we were able to negotiate and get that done. Some clients wanted to reopen top-up enrollments. Okay. And, while the enrollment had closed, but midterm, because COVID was around, clients wanted employees to subscribe to, top-ups again. And we were able to negotiate with insurers and get this opened as well. On the PPE equipment, there was a huge furor, because initially all PPE equipment was being considered as consumable and, non-medical expense. But as Marsh, we engaged with all the public sector insurers. We even spoke to the regulator on the sidelines, and we've been able to influence that, I would say. And now there is PPE equipment being paid. Of course, there are sublimits and there are caps, but it is getting paid, right? So that's another one wherein if you look at home quarantine as well, we made a lot of representations. And now you see a part of a lot of the new products that have come up include home quarantine as well. So I think it's not just about billing, but it's across the spectrum. And I think we encourage clients, if you have any specific requirements, we will be there to kind of open the negotiation and work with insurers and see if we can get that done.
Thank you, Manish. Thank you. I think on a quick note again out there, we have also been advocating to clients that within the corporate buffer to build a discretionary buffer which can allow payment of some of these, bills which are otherwise not being paid by the insurers, especially for COVID-19. It cannot be done probably in a regular way for any claim, but then maybe for COVID-19, given the pandemic situation, insurers are open towards that with the right kind of price. So yes, however, we do understand a concern here. We are in active discussion with the insurance companies, TPS, to find solutions. As we speak, Dr. Rajiv has organized some meeting with the GI Council members, as well as the TP and the insurers next week. Hopefully, we'll try to see if we can, do some more work out there. I'll quickly, invite Kunal. Hi, Kunal. Thanks for joining us. Kunal, many of you will be aware, is the head of rewards for Flipkart. And Flipkart today, of course, we all understand that how e-commerce as a sector is supporting entire India in terms of, fulfilling the consumer demands. So very unique space you are in, Kunal. So I'd like to understand from you, how have been your own journey, in Flipkart, when you have coping up with COVID-19, with increased business, increased demands, and a very, lockdown situation. How has been your journey and how did you support your employees to this journey?
Yeah, thanks, Praval. Thanks, Tanushri, for inviting me. I hope I'm audible.
Yes, yes.
Yeah, see, you're right, Praval. We are in a very unique space. While a lot of business have directly gone into work from home, our full business is not working from home, right? And that's obvious, right? Because if we have to deliver and cater to your needs, we have to be on the ground, right? And keep delivering. So, we started working from home long before the government actually did the lockdown thing, and we were actually not completely operational because of the first 21 days of very hard lockdown, right? And then we started discussing with the government what is essential, what is not essential. But you'll be very surprised to know that in this entire lockdown phase, we actually opened up 3 new categories, right? So we opened up groceries, and that is how Flipkart operates. So we opened up groceries. We were in 5 cities, and while it was almost on a semi-lockdown kind of a condition, we could actually go ahead and start delivering to that. So which means that more than half, 60% of our workforce were actually working from warehouses, packaging things, delivering things, and all of that, right? So they were on the ground, and we call it at a high risk, environment in current conditions. So that was one. We opened up hyperlocal. Hyperlocal delivers in 90 minutes most of your needs in at least again 7-8 cities, and we're expanding. And then we opened out a wholesale business also, which is also into a very high end, packaging stuff and everything. And this is a very human intensive, business to be in. So, when we look at this high stake workforce, right, for us, it is basically, wellness has become, or maybe insurance, wellness, health, all of that has become a business priority. It was never as big a priority as it was there, right? So suddenly it has started getting discussed in CEO staff meeting and things like that, right? And we need to give regular updates on all of that. And what are we doing? Now, why is it so important? Because it directly tells us about our business continuity plan, right? So for example, if one warehouse has one COVID case and it gets spread, for me, out of all 70 plus warehouses we have, if there are 5% of the warehouse also, which is 2 or 3 of them maybe, gets COVID infected, for us, it's a big thing because it's directly a revenue loss, right? And we cannot do that. Now, as we are progressing in a year, it is even becoming more difficult for us and important for us to manage this because one, the COVID cases are rising in India. And we are getting into a festive season where exactly, all retailers typically try to download their, and offload your products in either with us or with our competitors, wherever. But of course, it's a festive season for us, right? So the entire Flipkart is working maybe 15 hours a day to ensure that, we meet our, demand for India. Now that's on the second side, the business continuity, we told you the high risk was for. The third thing why it's so important for us is because, see, Unlike a lot of e-commerce companies, we started building solutions for India, right? So we understand the Indian ecosystem a lot well. While a lot of organizations will not go to the last mile, we have already gone to the last mile. So we are there out there, right? So if you look at the pin code, we are almost present in 100% pin code. So which means that our workforce is extremely scattered, right? How will you design wellness for them? How will you protect them from COVID, right? It becomes extremely important for us. Now we did a lot of stuff because we didn't get time to move directly from an offline wellness strategy and all perspective. We had to work day and night to move it to offline. And I'll tell you what things we have done. But what has happened is that our timing of a renewal actually played a big role, because our renewals were typically in the month of June. So we could actually fathom and gather what the COVID impacts is. And we have taken very, very quick calls in terms of how do we need to change our plan. We are on flex benefit, you know this. Which is working beautifully for us for the last 2 years. So for us, we could just make it a lot better and beautiful out there, but we wanted to make it extremely COVID specific. So what we did is that we did 2-3 things. When we look at the entire gamut of wellness, benefit, health, all of that, we could break it into 3 or 4 big chunks. We said that insurance is one big piece. Non-insurance, we call it the COVID care and specific programs, which was the second big pillar for us. The third one is that we have to constantly educate and engage people, right? So that was the third pillar for us. And the fourth one is the task force, I call it. Now, all of it got wrapped up beautifully with the kind of communication plan and the kind of communication program we have in place. And I'll talk a little bit on each of them. I'll not take much time. I know Tanushree told me it's 10 minutes for me. So some of the things we've changed in insurance is that we have got a domiciliary treatment of around 50,000 for employees, which means that, can take home.
We know that, yes.
We have an exclusive COVID corporate buffer for around more than 1 year now. We have we have dedicated Spox and broker implant and let's say TPA implant only to take care of COVID resource needs, which means that, there's a one-point contact for if you need online, if you need COVID test, if you need to get admitted to hospital. We are also getting COVID cases in the organization. I will not lie on that. In spite of doing everything possible on safety and all of that, we are getting that. But the way we are managing it is something we have to look at, right? We have enhanced our term life cover. Ensure that, at the base also, at the highest zone where people typically don't have that bigger earnability, yet their cover is very, very rich, right? God forbid we should not have a case like this, but in case if we have a fatality because of that, we should have a very strong cover for the family. But hopefully, till date, we didn't have a single case like that. What we did is that we also got a lump sum cover for all our ground force, which means that all our 60% people have a lump sum cover of around 50,000. This is not enough, but it is motivating for people to know that, hey, organizations doing so much for us, let me come back to work, right? Let me come back to work and ensure that because if you remember the first few days, right, Modi ji said that you cannot take out people at the same time you have to pay them full salary, right? So a lot of people stopped coming and they got the full salary. So we had dealt with situations like that. But at the same time, we have very dedicated workforce who said that, the organization is doing so much for us, let me come back to the workforce and support. So we did that. Specifically on COVID care, right, we have doctors deployed in all locations. It is a humongous cost we carry because each doctor resource is a huge, but we felt that, if we have a doctor, we have a safety net in each of our warehouses and fulfillment center. We have COVID test tie-up almost free for all employees across all locations in India. So if something happens in, let's say Darbhanga also, we know there is a tie-up somewhere out there, right? So that's the split and the length and breadth we are looking at. Now, some of the very innovative stuff we have done, I'm very sure some of the organizations have also done it, is we have a hotel tie-up. So what we did is that we did a hotel tie-up with almost 4,000 hotels, pan-India. Of course, it's paid by the employees, but this is for the COVID negative employees, which means that in case there's something happens in the family, they can just check into a hotel, right? And the hotels are giving very subsidized rates across all. There's a 5-star to a 2-star kind of a hotel. People can figure out what they want. Teleconsultation is something we have done it because, as I said, that people are on the move, right? So they will not wait for a doctor at the warehouse to go back and check. So they call up and figure it out. What we did multiple sessions on awareness on what to eat right, how to sleep, awareness, anxiety, staying lonely, how do you cook, and all of that. We did a lot of engagement around it. I'm talking about the third pillar here. We did something called as an online fitness classes, which was actually was done in campus, but we overnight moved it to an offline. And then today we have around 1,200 logins, which means that 1,200 employees are for sure login. And I'm very sure some of the family members are also working out with them, right? So we have a morning, evening kind of a session. And by the way, when we used to have it in the campus, there used to be not more than 20 participants. But now I think offline model is working really well for us. Now either people have time to do it, I'm not sure, or their family members are pushing them to do it because they're at home and they said, "Karoge kya? Please attend one of the workout sessions," right? Things like that. We are doing a lot of blue sky talks on mental well-being and all of that. But what we did, and I think this is something which I'm extremely proud of, is we started coaching managers to not pressurize people. Like, for example, like when you're at home, right, you end up working for 12 to 14 hours. Not saying no for a meeting is extremely pressurizing for team members, right? So we started coaching our managers, and it's a manager essential program for us. And we have almost covered all managers, and we told them that, hey, if your team member has a priority, saying no for a meeting is good. Okay, that's not something which you should. So we did that because, we are an extremely agile organization. We still are in startup mode. People work around the clock and everything. But we build that level of manager sensitivity, and we are seeing very positive colors out of it. We can discuss that in detail in different ways. But yeah, we did sessions on ergonomics and everything. But what I want to say is that, with this change, right, a lot of benefits also changed for us. For example, our mobile and broadband, right, which used to not be such a elaborate policy. Now we have to make it elaborate because everybody's working from home, right? Things like that. We had to ensure that, we process salary advance in a flick of a second, right? So we made it an auto service kind of a thing, right? We had to give COVID leaves, which is anyways a part of, I think, most organizations will do. But how are we managing such a diverse workforce almost in more than 60 locations, 70 locations in India and everything? Is because we formed a core team, which we say that, every case is being tracked. Every case is being tracked to say that, hey, you need hospitalization. We will ensure that we work with MedAssist, Marsh, everybody, and get your hospitalization done, right? If you need home care, we will ensure that we get you that. If you need a home kit because of COVID, a medical kit, we will ensure that we'll deliver it to you, right? All that we are doing. And what we are also doing is that we have ensured that, we communicate things really well, because you can do a lot of things, but if you have not communicated well, it will never show. So communication is the core thing for us. So we have to repeatedly say, in spite of launching the playbook once, we realized that it is not pitching the way it has to pitch, right? So we launched it on WhatsApp, by the way. So everybody has it as a screenshot in WhatsApp now. So if you need a help, if you need COVID test, have a quick dial and you have a COVID test. If you want to go, if there's a hospitalization required, there's a guy who is there from either Marsh or MedAssist who will have to get these things done for you, right? All that is done. So I think what has happened is that I can safely say that this length and breadth gave us a huge, there was a challenge, but it also was an opportunity to showcase our role as a team who was managing insurance and wellness, and it has become an internal case study as well now. So we have been featured in one of the US journals now as one of the top 20 companies who are actually in one of the books actually who are providing the best COVID care, right? So we presented our case there. So, and things like that, right? So I believe that, I have worked in organizations which work in 1 or 2 locations. Managing a lot of it is still a challenge, but it can be done. But this length and breadth, and in the short period of 1.5 months, was a case by itself. And I think we are doing a reasonable work, but I think we can still do a lot more. We are working towards doing a lot more. We are evaluating our overall insurance program also a lot differently now to see that, it is catered to the long-term need, because I'm sure that COVID is here to stay, and it will stay for at least 1 more year. And
at least a year more, yes.
At least a year, and vaccine and vaccinations and all of that. I'm not sure. I'm not very confident on that. So maybe it comes one day and we all come out and maybe have a drink together. But yeah, yeah. But
thanks so much, Kunal. That was really insightful. Very insightful. I think it has always been a privilege to work with you so closely. Right in the month of April and May, when your renewal discussion was going on, and at that point of time, we already spoke about home care. We already spoke about home quarantine, enhanced corporate buffer. So that was always ahead of the curve. So in March and April, probably the entire COVID-19 and how it will impact was not invisible. But that's when in the planning stage itself, we were able to look at how things may unfold from IPD to move into OPD, home care, and together all of us could build all those solutions. So really
yeah, and we have thanks Prabal for saying this. We are an unreasonable client, and Prabal, you have worked with us so closely. You know how unreasonable we are, right? And we choose to be like that, and we want to be like that, right? Because we want to ensure that while others are thinking, we want to move the scale forward and get things done, right? So honestly, I don't get time, and I will not give you time. So that's how it works for us. So thanks.
Absolutely, it's always a pleasure to work with you. Thanks so much. Thanks so much, Kunal. Really, I think client who push us, client who demand more from us, we all are there in this together for long, and we always do better than today. That's what we also believe at Mars, and thanks so much for partnering us. Yeah? Thanks. I think we'll take a couple of more questions before we open the lines. We have one question we have one question from Bina again. She wanted to know more about defined contribution model. So we spoke about how in flex benefits, from defined benefits, we are moving into defined contribution. So Gaurava, Tanushree, any of you would like to take this question?
Yeah, thanks, Praval. Hi, Bina. So in a defined contribution versus a defined benefits model, typically what happens is that currently organizations who are in a traditional benefits model, typically when we say traditional benefits, we mean that, one size that fits all is what we believe in. So it's a defined benefit model where the organization decides that this is the benefit that I select for my employees and this is what I'm going to offer. Versus what we are saying is that let's move to a defined contribution model where the organization says that this is the amount that I'm going to set aside for my benefits. However, at the same time, I'm going to give you more choices and bring on the plethora of benefits on the table. That is the flexible benefits model. It's on a co-sharing basis. You get a lot of benefits on the table, and at the same time, it's cost sensitive and on a cost sharing model. So that's a very brief, but yes, we are happy to connect offline and discuss this much more in details. So I will touch base with you. Yeah.
We have one question from Sushma Nair. This is about, does Mars have a doctor on call facility for people working from home? We spoke about it in the webinar today. So Dr. Rajiv is here. He is leading our digital healthcare initiative. So he can speak a little more about digital healthcare and what we do at Mars in that space.
Thank you, Praval. So we have facilities around telemedicine, and we have onboarded 2 or 3 large telemedicine players with us, and we can facilitate 24/7 consultations related to COVID or non-COVID for the entire family. And as of today, as we speak, we extended COVID helpline almost by the 3rd week of March. And today we are almost 350 clients are onboarded on the platform, and almost 50,000 plus excess consultations they have availed. And I think we will be happy to facilitate the same thing to you as well.
Sure. Thank you so much, Dr. Rajiv. I see many questions around the same thing that Vaibhav spoke about, and Vaibhav wrote, and we did answer that question about GI council rate. There are questions about cashless, sometimes hospitals are not entertaining cashless for COVID-19, why is it so? Just to quickly tell you, one of the reasons why hospitals sometimes are reluctant to accept cashless is because of the cash flow taking more time than BAU. In a normal turnaround, probably would have been a month for a hospital to get the cashless, claim settled through the TPA. But yeah, maybe in COVID, they have experienced that the turnaround time is a little longer, but I think that's coming to a closer now, with most of the claim payments being regularized by the industry, insurance companies and TPAs working together on that front. So I don't think that should be a challenge going forward. Having said this, if you do find that any hospital has refused cashless or is, increasing the hospitalization rate, do bring it to the attention of your Mars client executive, and we'll like to, specifically tackle those hospitals by, either to the insurance company or to the TPA. Will try to discipline that. Yeah? So these are, like I said, unprecedented times. Yeah? So we'll be doing that. Yeah, Dr. Rajiv.
Just to add on one more thing, probably, again, the regulator was proactive, when this representation went to them. And so they came out with a regulation that no hospital which is in the network can deny cashless. And today, barring few instances which are primarily happening in Hyderabad, we don't see this challenge across all other parts of the country. And we have been able to manage by a very active dialogue and intervention coming in from the insurance company as well as the TPAs.
Sure. We have a question from Sushma Nair. So Sushma is talking about October being a mental health awareness month. How do we plan to, support this? Sushma, we do have a range of, digital interactive session, right from podcast to video cast, also planned. And along with that, we are planning to have one global webinar in October for mental health care, where some of our leadership team from UK also be participating. So yes, you'll soon hear from us more about the mental health well-being, and the webinars related to that will be on the ground to support you to this journey. Thanks, Usman. So we don't have too many other questions that's open right now. The lines are open. If any of you'd like to have any questions put up to us, the panelists here, we can open your line and you can ask the question live. We just have a question coming up from Nisha here. What are some of the provisions that companies currently provide under virtual healthcare? I think Dr. Rajiv did speak about the digital healthcare platform that we have. And yes, Nisha, you can, reach out to the Marsh executive, and if, my colleagues can also get in touch with you and share with you more about, what kind of virtual healthcare support we can provide you out there. Mostly doctor on call, doctor on chat, booking appointments online. I think all of that can be there. Sajita Mohan Kumar had, I think, raised her hand. Sajita, do you want us to unmute you and you'd like to have any questions out there? Nilati, you'd like to unmute Sajita? Maybe she has a question out there. Hi, Sajita.
Hi, Sajita, can you hear us?
Yeah, I think she's there now. Yeah.
Hello.
Sajita, you have any questions for us, Sajita? Not, I guess. Yeah. So I think we don't have any more open questions right now in the tab, and most of them have been answered. So with this, I think I'd like to bring this to a conclusion. Thank you so much. We already passed 5. I understand that today is a Friday afternoon, and all of you'd like to probably close up your day and move ahead for a weekend. Thank you so much for joining us. We look forward to being in touch with you. Thank you once again on behalf of Mercer Marsh Benefits out here. Thank you so much.
Thank you.
Thank you.
And,
Thank you, everybody.
I think you all wanted to know if we are going to share the presentation and the webinar link recording. Yes, we'll do that after the session. Thank you so much.